Bringing people in there.
Good evening, everybody. How are y'all doing?
Doing very good.
Good, good to hear. Everybody geared up for the holidays? Got all your things done? Did everybody start here months ago buying things like we should have? Or are we scrambling? I know I'm a scrambler. I work best under pressure, so I'm always last minute, even though I don't plan to be, but and then pray and hope that the delivery dates are before Christmas, right? Does anybody still go in store shopping, like in just to do that whole day? Yeah, I'd like to, but time always gets away from us.
I'm one of the crazy ones. I start at 5 a.m. on Black Friday.
Oh man. Oh man. I've done that a few times and I get angry. It's like I get hot in the stores. There's too many people. Like it's not a good situation for me. So yeah, I don't, I don't go. Right. Well, we can go ahead and get started. Yeah, hope everybody's had a good holiday, had a good Thanksgiving. No, we got, holiday season. Hopefully everybody's, like I said, gearing up for Christmas holiday and got some time coming off. But yeah, we'll get started and welcome tonight. Thanks for everybody for jumping on this evening for our late night edition. We'll go ahead and move to the next slide here. So this will just be our agenda for the night. We're going to go over some childcare licensing, early childhood system updates. If you all have any updates you want to give from things going around the system, we'll do that. We'll do updates on our work groups, and then we'll have time left to jump into our work groups and meet however long we think we need to. So with that, I'll move to the next slide and turn it over to Megan to hit some of the topics we got.
All right, good evening, everyone. So I have a few updates. I'm going to drop some links in the chat in just a minute to kind of follow along with this, but wanted to follow up on some requests from the meeting last week. Or last week, last month. That is where my brain is tonight. Last month. One is we talked a little bit more about some of the childcare zones and the 7 grantees that we have, and there's now a summary available, so I'll drop a link into the chat. This is the map where you can see where those grants are happening, and as a reminder, the childcare zones are funded through the preschool development grant. At least 2, or in some cases 5 counties are coming together to say these are the most critical childcare needs in our area, and here are all the different ways that we want to address them. So I've had the pleasure of working closely with those grantees, and I can tell you there's some really exciting stuff happening in these communities, and I think we will figure out how to, as they have a little bit more time to get things off the ground, make sure we're bringing that back into you so you can follow along. But the summary that I'll link to in the chat in just a minute has kind of an overview of like what the biggest strategies each of those communities is looking at. If you are in or work in any of these counties and are not aware of the work, you can see in the bold who the lead grantee is. These are highly collaborative grants, so these are certainly not the only organizations. But if you want to be put in contact just to learn more about what's going on in your area, please let me know. We've been able to do that with quite a few connections, and it's been really cool to see how these communities are kind of getting more plugged into the broader early childhood system. So if you're like, I live in Crawford and I didn't know about this, like please let me know. I'd be happy to make a connection. Okay. And then we also talked in November, there were some requests for just hearing a little bit more about kind of how things have gone with the childcare capacity accelerator as well as the capital projects fund. So I'm going to talk a little bit about both. I will say I got to watch a lot of this from a close distance, but this was definitely not I'm not the expert. So I'm kind of sharing some information. This was shared at a recent children's cabinet meeting. And I will also link to the full reports on both of those funding sources so you can see a lot more detail about like the projects and who was funded. But wanted to take some time to just talk about like there's been some significant funding and significant impact made in childcare in Kansas in the last few years. And I think sometimes we get so busy we kind of forget to like stop and reflect on that. So again, I'll drop the link here in a minute on these reports so you can dig in more closely. But the Childcare Capacity Accelerator, this was operated by the Kansas Children's Cabinet. 4 different funding sources were brought together. A lot of COVID money, that ARPA, American Rescue Plan money, as well as some preschool development grants. So all like time limited one-time funding sources they were all blended and braided into making about almost a little over $54 million possible. And the purpose of this is very specifically for construction, which, as we know, like there's not a lot of funding around childcare construction. And so this was a really big deal when this opportunity came up in the state. It was for new spaces or renovating spaces, and with the primary purpose of making sure that we're adding licensed childcare slots. So we had 63 grantees, all awarded in 2023 across 2 different cycles. And most of those projects are complete. We have 3 that are still going. Construction takes time. And those are on target right now to be completed by late next year. This is, I think, a number worth like stopping and appreciating. The grantees are totally projected to create over 5,100 new licensed childcare slots in the state. So there are a lot of communities that have, new centers or have just stood up programs that are designed in sustainable and creative ways that reflect the needs of the kids and families and professionals in their community. Almost a third of those are for infants, and that includes 4 counties that had a very serious infant desert that had 0 slots available. So really, really exciting progress. And then the programs have helped hire 802 staff. So I think some of those are probably just additional for existing programs, and some are obviously you need to staff a new program. So again, I'm sure some people have been very intimately involved with this because I know you've been involved with the accelerator projects in your community, and others have probably heard bits and pieces, but those are all significant numbers. So just wanted to take a minute to like call that out. And then the Capital Projects Fund kind of ran parallel. It was a similar timeline, 2023, different funding source. So this was money that was made available federally from the U.S. Department of Treasury, about $40 million. They put out funding that was all about using community spaces for several different things. Work, education, and health monitoring were their big things. So things like public health clinics, places where people can go do job training, job interviews, build those skills. Education, I think that obviously can mean a lot of different things. So things like after school programs, higher ed, non-traditional students having space, things like that. English as a second language. So Kansas took that as an opportunity to say, those are all really great things. We also want to make sure that early childhood is represented in there. Is it okay if we add adding licensed childcare slots as an opportunity? And they said yes. And so we were able to the Children's Cabinet, was able to award 10 grantees in 2023. Just over half are open and 4 more will open in the next year. Some of these I think actually have been mentioned in this group, and I know in probably some of the work groups, some of these are being used. This is, again, not the only ones. You will see a lot more information when I link to the full reports, but I wanted to highlight a few that are, I think, really exciting. And possibly models for other communities. So one is the Flint Hills Community Accelerator. This one I know has been mentioned in this group, but they are bringing together telemedicine, primary care services, childcare, and then different resources. So people who are looking for a job, who are looking for just a little bit of more higher education opportunities, things like that can come use the space. And also, I think doing some really innovative things around like how do we help build up our childcare workforce and support the fact that these are small business owners. Another one is at St. Benedict's Abbey. So they took a what was a correctional facility and are making that into a space again to meet all of these different needs. It'll have childcare, it will have broader healthcare needs, and then meeting that education and workforce requirement. So every project has to hit all four of those, but there's a lot of uh, they can do that in a lot of different ways based on what they say the biggest needs in their community are. And then last but certainly not least, in Clay County, they have a new center called the Life Center. I actually think it's like all capital life, which is intergenerational. And so they're bringing together a space for older adults, childcare, they'll have a commercial kitchen, a youth lounge. So they kind of took that like preteen, teen space, elementary space, and then also some of the health spaces so people could get health care and people can come in and work in there or do different trainings and professional development. So I will say intergenerational care is like a near and dear to my heart. So that one makes me, I'm excited about all of these, but that one, like, I just love seeing more and more of that pop up in Kansas. I think that's a really great thing for the community. Okay, I wasn't sure if that was my last slide. I know it was like a lot of information quickly. Are there questions on that? Or does anybody like want to highlight a program that's going on in their community that was funded by any of those sources? Okay, perfect. Okay, well, we just wanted to, we knew that came up as a question. I'm gonna drop the links to each of those resources here in just a minute. And while I do that, we'd love to hear like what's going on with you all. Are there any events you want to share, bright spots, anything you need from the group, or just want to celebrate?
We've here in Wichita, we've partnered with the Wichita Collective Impact, which is basically housed out of the YMCA regarding kindergarten readiness. Their main focus is our 67214 zip code, doing activities with families that they can take home and do with their kids, but they're also wanting to reach out to the providers. So we are helping them make that connection. But they're also not just sticking with the 214 zip code. They're wanting to focus like on the privately mom and pop shops, whether it's centers or homes. So we're trying to get them connected to help with the kindergarten readiness on that.
Thank you for sharing that, Adriana. That's a good example of like certainly a childcare need, but also like a bigger just early childhood need. So I appreciate you kind of highlighting how you're working together around that. Anyone else? Okay. A quiet group tonight. I know it's late and it's like the week before Christmas. I'm feeling it too, friends. I get it. I get it. Okay, well, let's switch into our just we want to like make sure that we can only be in one group at one time, but we want to make sure that people kind of know what's going on generally. I know we've only met once, so I'm not expecting anybody to have, solved all the problems for their work group, but just wanted to highlight a little bit of kind of what some of the conversation was in each of those groups so that if people aren't, if they're in another group, that they are aware of what's going on. And certainly if you have resources or questions or anything else you want to do, we're okay with a little bit of cross-pollination across work groups. So Jarvis, do you mind if I start with you and your group?
Yeah, we can do that. I'm gonna just kind of bring up our notes here. We kind of used that spreadsheet that was sent over. So we had the innovative childcare models We felt like there was, a few things out there already that, we could kind of try to highlight and do some more research on. One of the things was the small center pilot. Um, that was a very successful pilot we had. We've got some programs that are currently working on this under the small center pilot. We did have a report that was generated from that. Haven't had a chance to dive into that report, so I think that would be something that would be a focus area for us for the next several months to really look at that report and see how we can move forward with that. Because, like I said, that report came in, but with all the things going on in licensing right now, it's been tough for our program to kind of dive into that and see what we need to do next. So I think that's a natural connection there and a way that the SIT can help in that aspect of things. So. Also, just looking at from a licensing perspective, what can Kansas, learn from these different models, especially from the zones, um, and what are the non-licensing barriers to run these programs? That's going to take some looking into, and getting with other agencies and programs to see how we can get help from them to, build some different models. Um, also just taking time to look at other states. I'm not sure how much has been done in that arena. Like I said, it's kind of a new thing that's going on. We've got some different ideas going on across the state, but also, I don't think we've had the time to see what other states are doing. So I think that's going to be something that's going to be very helpful for us. Um, Talking about who should be a part of that conversation with innovative childcare models. We talked about obviously Childcare Aware and our other resource and referral agencies tapping into that resource. Um, I think that one thing we also talked about was, getting individuals involved in this conversation that aren't normally involved. So bringing in different businesses. And I think that's something in general that the early childhood landscape's been trying to do is, bring other individuals and agencies and organizations into the conversation that we normally haven't. I think that may bring about some different ideas on things as well. Let's see what else we've got on here. We also we've got, like I said, other communities doing other things. We had the child care incubator in Riley County. That's been huge. I know there's been a very successful effort there and looking at what can we take from that. We got some really cool things going on. So what can we take from that and try to scale that and help other communities learn about what's going on. That way, there's not different pockets of the state just kind of in the shadows doing things. And it's good to get these things out so others know what's going on and maybe that can be reproduced in other communities. Let's see. I think the last thing we've got here. Let's see. Yeah, the last thing we're talking about is just, obviously the House bill, was passed and there's some things in there obviously that make it hard for what we're trying to do now. But, looking at the bill, really embracing some of the stuff that was in there. And one of those things was it gave the agency the ability to really look into pilots. So we're talking about really embracing that. Let's take that, and we have that authority to do those things. So how can we really wrap ourselves around that change and take that and use it for what it's meant to be and what it's meant to do for the state. So I think that might be it on what we have on our spreadsheet here. So.
That's
I think
that's a lot.
that wraps it up. Yeah, we
It's
had
like a
we had some
robust
really good
conversation.
conversation. Yeah.
Does anybody else from the Innovative Childcare Model group want to share anything else that came up last month or maybe you thought of since then? Okay. Well, that sounds like an exciting conversation. We'll be curious to see what you all talk about today when we come back together in January. So I can share. So for the strategies to retain childcare facilities, we also had a robust conversation. So that's a big topic, and so we were kind of trying to figure out where do we get started. So a few things, a few kind of themes that came up. Excuse me. We're looking at like there's a difference between a resource existing and somebody knowing how to utilize it or feeling like it's for them. And so wanting to kind of know, like, how do we know if a facility does know what resources are available through the system, through childcare licensing or the R&Rs or CCSIT or anybody else? Like, we don't necessarily want to assume that there isn't a resource. It might be a knowledge gap. And so what does that look like? We also talked about, there's a lot of change going on between the bill, like Jarvis talked about, with Office of Early Childhood coming. Like, how do we just, I think in this moment and just in general, how do we make sure that as a system we're providing really clear and consistent information so that it doesn't add frustration for providers? They feel supported when there's changes. They feel like they know who to talk to if they have questions. It doesn't, like, just kind of talked about, like, how do we make sure we're not unintentionally doing anything as a system that adds any additional pressure or confusion. And we also had a conversation about like what when we talk about like what supports a facility needs, or we also kind of like we're talking about both individual level professionals and facilities. Of course, facilities rely on having consistency and quality of their individual professionals. And so we felt like it was important to talk about both. But like, how do we know kind of what support means and what people really are looking for, so that if we're looking at what the gaps are we kind of operating from the same definition of like what an expectation of what childcare providers and facilities, like what's the level of support they need? What are kind of those key intervention points? And are we on the same page about that? Again, we talked a lot about like how do we hold space in these conversations for both the individual level early childhood professional and wanting them to feel like this is a career pathway for them, and also how does that fit within what the facility needs as the program as a whole. So we talked about like how do we make sure that facilities know about like professional development resources for their staff, links to quality, just all the different resources that we know exist. And then again, if we kind of get a better sense of like how aware are people of what does exist, then what are those most critical gaps that we might need to address? And as we're working to address gaps, how do we make sure we have true representation from the people in our field? How do we make sure we have early childhood educators who are consistently at the table and saying these are challenges for us, or these are things that are working really well and it's a scaling issue? Particularly with like the Office of Early Childhood coming in, how do we make sure that like from the start that we are really making sure to elevate providers' voices along the way? We also talked about, again, like other resources we want to make sure people know about, things like the career pathway with CAPE being rolled out more and more, links to quality. One thing that was flagged is seeing, I think it's like probably too early to call this a trend. Those in the CCL team, correct me if you feel differently. But seeing more facilities starting to not renew their license versus closing and kind of wanting to understand that a little bit more. Is that people, maybe they were getting ready to retire and it just happened to time out that way, or they want to take fewer kids, or they're not seeing the level of demand in their community. So just kind of wanting to differentiate, like closing might not just look one way, and under better understanding, like the idea of exit interviews came up. I know that's come up a lot in the system with individual level people, but also kind of wanting to understand that with facility levels also. And then lastly, looking at like just making sure that any communication about things that are new, like things like CAPE, the core competencies, the career pathway, I think really anything like that, the language when it goes out feels really like supportive and people feel like, oh, this is exciting and an opportunity and not like an added burden or like another thing to navigate. I think people shared a little bit of feeling that in certain instances, and just recognizing that there's a lot of burnout and there's a lot of like navigation fatigue, I think, in our workforce. And so how do we make sure that we're meeting people where they are, and not making it feel like here's one more change, that it's really something that we want to benefit the workforce. That's like the number one goal. And how do we ensure that that is being received that way? And if not, do we deal with that? So does anyone from my group want to share anything else? Okay. Last but not least, promotion and marketing of licensed childcare programs.
Yes, hello everyone. This is Clayton. I have been helping with the promotion and marketing of licensed childcare programs work group. So I'll just give a brief update of some of the discussion that we had and kind of how we're thinking about the scope of the work for the group. So in relation to the question of what's the focus for the group and why, the group discussed three different related areas of one wanting to retain the current licensed providers and make sure that they keep their licenses. The next one was educating people on the benefits of licensed childcare and how to access those benefits and how that can be a good indicator for quality and safety in childcare. So emphasizing that for currently unlicensed operators to see the resources that are available for licensed providers. And then also the third area was talking about these with, or this information with the general public, specifically with parents knowing the difference between licensed and unlicensed providers and the difference between like family and childcare homes and all of these different situations that they're navigating, just more helpful information that is clear and accessible for this system that they're navigating and what it means to be a licensed provider. The other question that I wanted to discuss that we talked about was what related efforts should help inform the work. So we talked about statewide resource and referral networks, how they discuss licensed providers and licensed childcare with their clients and people that they're talking to. Also discussing this with parents and different community groups and just the governance groups within the system to emphasize what information can easily be understood about like the differences. We also talked about emphasizing this with economic development and how this can make sense in business models as well. And then also utilizing previous toolkits and media campaigns that we've already created, like the Childcare Matters campaign and such. And then we talked about for additional information and going forward, looking at how different websites on the current system discuss what it means to be licensed and unlicensed in childcare, looking at like the All In for Kansas Kids websites, Childcare Aware, like all those different places people might be accessing information and how we might be able to synthesize what's being provided and have some like key common talking points to discuss those differentiations. So that's mainly what I wanted to share about our discussion from last month. But if there's anybody else on here that was in the discussion and wants to bring something up, please feel free.
Okay, thanks, Clayton. That's a lot of content for 1 hour for this group. So thank you all for your engagement and excited to dig back into kind of pick things up again today. We will go into our work groups in just a minute. Just a friendly reminder to have somebody take notes that might be your facilitator, but if you have another agreement, please let us know. And then, like I said, we'll do this each month just so people kind of know generally what's going on. And if you maybe or know somebody's in another work group, but know that their organization works on something, like we can help facilitate those connections. We want people to really feel connected to all the work the CCSIT's doing, even if they're not in that work group. I'm going to go off agenda for just a minute because I realized I failed to introduce the fact that we have a new member. And I'm sorry, I meant to do that at the beginning. So Becky, I'm going to put you on the spot, but I'm wondering if you're willing to do a quick introduction of yourself.
Sure. I'm Becky Stewart, and I'm currently the program director for the Supporting Care Providers of Kansas. And I was a licensed in-home child care provider for 23 years, and then went on to work in a child care warrior for KQRS and parents as teachers for home visiting. And so have a really strong background in early childhood.
Great. Thanks so much, Becky. We're really excited to have you. And again, sorry I went out of order, but I think we realized that we really want to make sure that we have kind of that family, friend, and neighbor perspective. I think that's an important part of this conversation. And as you just heard, Becky brings a wealth of knowledge in that space and childcare in general. So welcome. We're excited to have you. Okay. So last but not least, just upcoming meetings. The next two meetings will be back in our morning schedule. So right after Martin Luther King Day on the 20th and then mid-February. I just wanted to take a minute to say thank you all. I know you are busy people. There's a lot going on in your jobs and in the world, and just appreciate you taking time to be part of this group. And I think, as you just heard, like even in, again, 1 hour of conversation, it was a lot covered across our three work groups. So just appreciate your leadership in this space and continuing to show up and be engaged and try to do some good work around childcare. So I hope everyone gets some time for themselves and I know I'm looking forward to turning my computer off and closing the door and not thinking about it for a little bit while I get some family time. And I hope amidst the chaos, everybody gets a little bit of whatever recharges you, whether that's the chaos or a little quiet, and has happy and safe holidays. So Jarvis, anything else you want to add before we break into our work groups?
Oh, no, I don't have anything particular. Like she said, yeah, thank you all for hopping on. I know it's, like I said, this is getting close to the holidays and we're all tired. It's cold outside, and just appreciate you all jumping on and the work you do. I'm looking forward to learning more what's going on through the work groups next time we meet.
Oh, I just saw, Emily, I just saw your comment. Perfect. Actually, I just got a question about this. So Emily shared, Emily Barnes with KAC, Kansas Section for Children. Excuse me, I'm fighting a little cold over here. They're planning a 2026 Early Childhood Day, and they'll be sending out a save the date soon for the end of February. Perfect. I think there will probably be a lot of people in this group that will want to know that date. So thank you, Emily. Okay, a final call for any last minute bright spots or things you want to share before we head to our work groups? Okay. All right. Thank you all. Enjoy your work group discussion. Take care.